Welcome to Oncology Podcasting. Today we are joined by Kelly Hasney, owner of a Perfect Fit boutique located in Harford County, Maryland. Kelly is a certified wig fitter offering a variety of wigs to cancer patients. Kelly, thank you for joining us today. Let's get started and talk about how you go about selecting a wig for a customer who visits your boutique.
There are several different things that we need to consider. Number one is the present color of their hair. The fact that they are going through treatment means their skin color will change. Sometimes we need to go lighter or sometimes darker than their present color. We also take a look at what they're going to be doing, their lifestyle. Because a wig is hot, it is synthetic, sometimes in a case where someone has had a long style, we want to go a little bit shorter, which makes it a little bit more comfortable for the person. Also, if someone wears eyeglasses, that's a consideration because a wig has tabs in front of the ears, which in some cases can make it a little bit uncomfortable for eyeglasses. So we take a look at that as well as if someone likes to pull their hair behind their ears. So there's a variety of factors that go into that.
If a customer doesn't want to wear a wig, what are her other options?
There's a variety of different types of headwear out there for them. We have some here. This is a scarf, and in the front to us it looks like a regular scarf. However, it's fully covered in the back, which gives them the security of other people not knowing that they've lost their hair. So they can wear this to treatment, to errands and things like that, and feel confident. There's also another type of scarf which looks like a regular eyelet scarf. However, it's fully lined on the inside. Even when they don't have hair, they'll still have almost a peach fuzz-like covering on their scalp, which if the item is not lined, the little hairs can get caught in the eyelets. So the lining is very important.
And when do you advise that a patient should start looking for a wig? Should she look before her chemotherapy, during, after, or should she wait until her hair falls completely out?
It's always advisable to take care of all of the things they have to take care of pre-treatment if they can. When they come into me pre-treatment, I have a look at their present hairstyle. It's often difficult when they've lost their hair or it's so thin and they try to explain what their style was. I can also get a better feel for what type of wig will be best for them. So if they can do it pre-treatment, also, as you know, once they start to get into treatment, they're not feeling their best, and the better you're feeling, you can make better decisions.
How do you speak to cancer patients who come in emotionally traumatized as a result of their hair loss?
It is, they will all say, the most traumatic part of going through treatment. Normally they will ask me, what should I do? Should I go get my head shaved or should I let nature take its course? Those are the two options they have. Once the hair loss begins, it's not a graceful process. They could lose all of their hair on one side of the head and none on the other. It's a very traumatic event for them every time they get out of the tub or out of the shower to have handfuls of hair. So it's always advisable to get it taken care of. I can do it, or they can go somewhere and get it done. And then it's one traumatic event, it's over and done with, and we move on to the next.
Could you talk with us about the main problems that you face when talking to a patient about a wig, and how do you deal with these issues that may come up?
There's not too many problems that really arise when you're talking about wigs. Wigs are sized starting from a very small size up to an extra large. There are some cases when, for example, I've had adults that have had very petite head sizes that have had to go to a child's wig because adult wigs were just not made petite enough. Every now and then, we all have different skin issues from time to time. So sometimes there might be a case where someone's scalp is just naturally sensitive, in which case there's different cotton liners and things that they can wear underneath of the wig to make them more comfortable.
Okay. After a customer has selected a wig, then what is the turnover rate before the wig is available for them to pick it up from your store?
I can have the wig ready for them, most cases the next day if they choose to. If they come in pre-treatment, normally they don't need it right away. If they've come in and they have a couple days, then we'll wait a few days. But normally I can have it the next day or 2 days later.
Is there anything in particular a customer has to do to their head to prepare it for the wig, such as any adhesives or anything like that?
Actually, the wig will be fitted to their head, so they need not wear anything under the wig. If they feel more comfortable, they can wear a wig liner, but in most cases they choose not to wear anything under the wig. So really the wig will stay on their head. If for some reason they do have a certain section of their head that's not shaped to conform to the wig, there is a medical grade water soluble adherent that they can roll onto their scalp that will make the wig stay in position. But most patients don't need anything like that.
Okay. And do most insurance companies cover the cost of the wigs?
In the state of Maryland, well, Medicare does not cover the cost of a wig with any documentation from a physician. In the state of Maryland, it is a mandated law that other payers do cover the cost of a wig. There is one exception to the Blue Cross policies, whereas a Blue Cross federal government policy, it is an exclusion. In most other cases, wigs are covered. If the patient is Medicare primary and Blue Cross secondary, for example, I would have to submit the claim first to Medicare to get that denial, to then send to the second party company. All of this does require a prescription from a physician.
Thank you, Kelly, for joining us today and sharing all the information with us about your boutique. In our next segment, we will take a tour of Kelly's boutique and watch as she performs a wig fitting for one of her customers.